Let's dive into the third step of the GSA KAER Toolkit for brain health. Evaluate. If you haven't already viewed the 2 previous videos, Kickstart and Assess, you may want to go back and watch them first. So we've already kick-started the conversation and assessment of our patient for cognitive impairment. Now it's time to act on what we've learned. Evaluate means following up on a positive screen with a diagnostic evaluation, either within your own practice or through a trusted specialist. In the KAER Toolkit for Brain Health, evaluate means that if cognitive impairment is detected, you either conduct or refer for a diagnostic evaluation. Positive screen triggers the need for timely diagnostic follow-up. Is this a type of dementia, depression, sleep issue, a medication side effect? We owe it to our patients to find out.
We knew all along, we knew something was going on, whatever you formally label the condition. When we got the phone call, when the nurse called us and said, yes, there is some brain atrophy and the diagnosis is Alzheimer's, however she worded it, from that moment forward, it felt different. I mean, it was like any horrible diagnosis of a disease, I guess. It just felt different from that moment forward. I mean, we knew it, we saw it, but when they label it, it was real.
Getting a neurologist is quite a feat these days, so any help you can have, anything that sets people on the right path to get support is a good thing.
A lot of times in patient visits, you spend time putting out fires or trying to deal with these urgent issues that come up, urgent concerns, when things like cancer screenings and prevention could have the biggest impact, but they can get deprioritized or pushed to the bottom of the list.
How you implement the evaluation step of the toolkit in your practice workflow. First, review the results of the cognitive screening test promptly. Take a few extra minutes after a positive screening test result. Then, apply the recommended components of diagnostic evaluation for dementia. They are: gather their medical history, perform cognitive and mental status testing, perform a functional assessment with the patient and their care partners, physical and neurological examination, neuropsychological testing, routine lab results, appropriate neuroimaging, and a specialist referral if the patient requires us. Visit carebrain.org for deeper details on these important steps.
Oftentimes we need to start really looking very closely at medications because that's really important, especially with a diagnosis of dementia.
I'm on a medication which is slowing the impact of this disease in the early stages.
We're treating and we have patients that have a dementia. It means that we can guide them through what to expect in the future.
It gives your partner and it gives you an opportunity to understand what's ahead.
Most patients will not need to go to a neurologist to get a diagnosis of a type of dementia. A PCP can have that conversation, they can do the assessment, they can do an evaluation initially.
The goal is in-house diagnosis wherever possible. When equipped with the information in the KAER Toolkit, primary care providers should be well prepared to diagnose mild cognitive impairment in dementia in most cases. Some complex cases may require specialist intervention, atypical presentations, early onset symptoms, requests for second opinions, or when the patient might be a candidate for disease-modifying treatments. But as a whole, we're serving our patients better when we can provide a diagnosis and explain it clearly to the patient and the care partner during their visit. The key is to respond to a positive screen with action. Evaluate means we don't leave the patients in limbo. We move forward with clarity, structure, and a team approach. As we're navigating the steps of the KAER Toolkit, remember, it's not just about diagnostics. It's about building relationships with your patients, their families, and care partners. When you open the conversation about what comes next, you help them feel seen, heard, and supported.
And whether you're in the early stage or in the most advanced stage, people should be treated with empathy and consideration.
The sooner you can get educated about things, the sooner you can feel like you have as much control over it as you can get, the better for everybody.
So that's evaluate, the moment where detection becomes direction. It's not about rushing to label, it's about getting curious, being thorough, and taking the next right step. You can learn more about the evaluate step and the entire GSA KAER Toolkit for brain health at carebrain.org. In our final video, we'll talk about what happens after the diagnosis, how we connect patients and their families with the help they need. That's refer.